we had been hit by Hurricane Beryl. Electricity was completely out, and I was just starting up my business, so didn't have um, we didn't have a huge impanelment, and so we kind of just shut things down. But then I got a call from someone who had cut themselves with a chainsaw, and they're like, "Hey, we need some help. Can you take care of us?" And so I was like, "Well, yeah, come on over." So he came over to my office, and I stitched him up in my office without electricity. So it was Hurricane Beryl, middle of the day, no electricity, super hot, sweaty, doing these stitches. Probably one of the hardest jobs I've done in terms of stitching. And but we got him taken care of in the middle of Hurricane Beryl. I mean, just after Hurricane Beryl, doing all the
I
cleanup and
mean,
all that craziness.
that's direct primary care for you right
That's
there.
direct primary care, right? Just
Like
meeting people where they're at.
middle of a hurricane, stitching somebody up that cut themselves with a chainsaw. Like
That's right.
nothing more direct primary care than that.
That's right. Yeah. It's kind of crazy.
Hello and welcome to the Best DPC podcast, the world's #1 podcast covering all things direct primary care. I am your host, Wayne Lowry. I am not a doctor, but I once beat my sister in the game of operation. Today, I'm thrilled to have with me Dr. Jordan Salmon. He is a family physician, a U.S. Air Force veteran, a father of 5, and the founder of Health Rising Direct Primary Care based in North Houston in Humble, Texas. From serving in the military to transforming healthcare with DPC, Dr. Salmon's story is one you won't want to miss. So let's dive in and introduce Dr. Salmon. Welcome to the podcast.
Thank you very much for having me. Pleasure to be here.
So you are. Tell me a little bit about yourself and what are you doing right now?
So, yeah, I mean, I'm a fem physician, like you mentioned. I was in the U.S. Air Force, got my training over at Nellis Air Force Base in Las Vegas. Great experience for me there. I went to England. I deployed to England, or didn't deploy. I was PCS, so they moved me to England for a few years. I was working in the emergency room there, and that was kind of where my whole DPC story began. It was more of a health story, actually. So for me personally, I wasn't doing very well from a health perspective.
How so?
It was a pandemic, so my hours actually got cut a little bit because there was no one going into the emergency room, so they didn't need me as much. So I had more time to do lazy things, and so I did more lazy things, and my health declined. I hit the obesity threshold, and I was depressed. We were far from family, and it was kind of a struggle for me at that time.
So you packed on your COVID 15 pounds or
My,
what?
my COVID pounds, yep, they accumulated pretty rapidly. I mean, I had always kind of struggled with my weight, and this kind of took it to a new level, right? And so I wasn't in a good place, and that's when I started to say, hey, I need to make some changes. But I'm a doctor, so I should know the answers. And so I went to see myself. It's like, all right, Doctor Salmon, tell me what we need to do. Right? You're obese. You're struggling with depression, and I didn't have the answers that I wanted to have at that time. I was like, okay, well, you got to lose weight, and depression. You can see a therapist, or here's a pill. Didn't have a great answers for myself.
I was going to say, always when you start with talking to about yourself in the third person, that's a little bit of a red flag right there. So, are you sure you're okay now? Do you still refer
So
to yourself as Dr. Salmon? I mean,
I,
that's
I am, yeah. So it was the beginning for me of like a health revolution, right? And that started my journey into discovering DPC and recognizing some of the needs that we really have. So I started changing quite a bit. I learned a lot about things that we don't talk as much about in the healthcare setting, right? The things that really get someone to be healthy. And
awesome.
so we started making significant nutrition changes, exercise changes, getting better sleep. I learned a lot about mental health from a whole new perspective and how we can improve our mental health.
Well,
And ended up,
I'm excited to dive into some of those topics related to your passion and what you're doing with your practice.
sure, sure. Yeah.
Before we jump into that though, I want to ask you a little bit about your personal life and some of the things that you're involved in. What do you do for fun?
Yeah. Okay. Yeah, I see where you're at now. So for me, I love sports. I like watching sports. I like college football more than NFL.
Okay, what's your
Um,
team?
I'm actually I went to BYU, so that was my undergrad, and so I still cheer for BYU, even though I'm in Houston. This is where the Houston Cougars are, so I'm a
Yep.
BYU Cougar. I don't say that too loudly, but yeah, that's who I cheer for. So
Well, you can just say I'm a Cougar fan. Oh no, no, don't
that's
say
right.
that.
That's right. I'm a Cougar fan,
Cougars. It's
and
important to add that S at the end. If you just say you're a Cougar fan, people might actually have some real questions about sending anyone over. So let's
there
be
you go. That's right.
let's
That's
be
right.
real careful about our terminology there. That's my
Yeah.
bad. So you enjoy college football. I love college football. We're getting, in fact, I think on a previous podcast, I might talk about this every podcast, to be honest. We're getting our own collegiate team down here in the Rio Grande Valley, and I am pumped. I've got my season tickets on order. We'll be doing seat assignment next month or later this month, and yeah, so we're pumped to have college football.
Yeah, no, I love sports, and my kids all play sports. So I'm a
What are
coach
they?
coach for one of my daughter's soccer teams. So heavily involved in sports and love being active.
Now you said one of your daughters. How many kids do you have?
I have 5 kids.
Five
Um,
kids.
yep. So 3 daughters. 2 of my daughters are in soccer, and then I'm the coach for one of their teams. Yeah.
Now, are your daughters the oldest? Do you have a bunch of girls and then some boys at the end, or are they all mixed in?
We got bookend boys. So first one's a boy,
Okay.
last one's a boy, and I think that's how it'll be.
Well, I asked that because I was a girl dad, for the longest. So I have two girls, and then I have my son, and that's one of the challenges. When you're used to raising girls, you kind of understand things, and then all of a sudden the boy's different. And I have a good friend who's the opposite. He's a bunch of boys, and then he has a girl, and it's like, okay, you got to rethink everything when you
That's
are
true.
used to parenting one gender, not just the having them both intermixed in the chain.
Yeah,
But
it definitely changes things up for sure. Yeah.
and on top of that, you got a business. You're in the sports. You've got a business. Uh, you're a busy man, I assume.
Yeah, we're very busy. Yeah.
So when we were discussing this podcast, I noticed you were born in Canada. So tell me about that. How long did you live in Canada?
So I didn't live in Canada. I didn't live in Canada long, but I was born there. My parents moved when I was a baby, for my dad to go to school. Came down to the states, and then we just visited Canada pretty regularly. So I still enjoy Canada. They've got probably better chocolate than we have in America, and
Really?
yeah,
So
yeah.
chocolate of all the things I've never heard people. I was assuming you're going to be like really enjoy the maple syrup or something. I don't know, but
Maple syrup's
chocolate.
good too. Yeah, they're
Okay.
chocolate. They've got a handful of different candies that candy bars and chocolate bars and things like that that we don't have here in the U.S. So
Well,
that's one of the
you could pay like a 25% tariff and get it. I think that's
that's
not oh, hold on. Just to be clear, not making a political statement, just making an observation that if you want chocolate, it would cost, 25% more right now.
that's true.
Uh,
You got to go. It's better to just fly to Canada now.
it's cheaper. Cheaper to fly
Cheaper.
to Canada, eat all the chocolate you want. So you mentioned a little bit about your health journey and your transformation. Now you lost a tremendous amount of weight when you started your practice, right? Or leading into your practice. Tell us about that.
Yeah. So yeah, that was like I was mentioning, that was a challenging time in life where I was didn't really feel very good and had to learn a lot about losing weight. I've come to realize, weight loss is extremely hard. I see a lot of patients who struggle with it, and especially in America. My weight loss happened in England, so I think it's a little bit easier there, right? We don't have as many fast food restaurants. They have actually very different laws regarding the types of foods that they're allowed to sell in stores and things like that. But needless to say, I learned a lot just about making small changes, how to improve my health. Ended up losing 65 pounds and felt tremendously better. I mean, that's an entire child that I was carrying around, and so losing that weight really reshaped the way that I think about health and the way that I approach treating patients.
I think, to be honest, I think if I lived in England and had to eat green peas every day, I would probably lose 65 pounds.
I know. So maybe I shouldn't say it's a great thing. I should just say, it just happened because I was in England, right? And everyone
Well,
loses weight.
no, but really, I think that's interesting you say that. I think about a trip I took to Italy, spent 2 weeks in Italy and lost weight, eating pizza and, enjoying the cuisine, and actually lost weight, came back here, tried to eat the same thing, forget about it. Like, I'm gonna pack on the pounds. So there's something to be said about what is in the American diet versus what ingredients are in the same style of food in European countries. So maybe we'll dive into that. Maybe we'll look at that here in a minute. But so you lost a lot of weight. You've gotten involved in this health journey, and that's been part of your inspiration and motivation to open up your own direct primary care clinic. So in that, so what are you doing with Health Rising? What are some of the goals, and just tell us a little bit about your clinic?
Yeah, absolutely. So, Health Rising Direct Primary Care. So, we are a clinic. I mean, a lot of the goals that we have are aligned with most DPC practices, where I think that the care that we deliver in the insurance based system just is not great care. People are being rushed in and rushed out. We're treating them kind of like they're on a conveyor belt, and you just got to get them in, get them out. And it doesn't end up being good medicine. We're treating diseases as opposed to treating people, and it's not the way that we need healthcare to be, right? So at Health Rising Direct Primary Care, we try and treat people like people, right? We listen to them. We try and let them know that they're seen. We let them know that they're heard, that we are here to be their team member and work with them, as opposed to just giving them a list of things that they need to do on their own and send them out the door as quick as we can.
So if someone were to walk into your clinic, what would be the first thing that they would notice? Tell me about like that first experience
First
of
thing
walking in.
is they're going to see me greeting them at the door, and they're not going to wait in the waiting room. So they don't have a wait. They see a
Hold on.
doctor.
Hold on. I'm going to stop you right there. So how else are they going to know what's happening in the National Geographic from 1984?
That's a good point. And so if people are really interested in that stuff, they can go back to insurance-based care and learn all they want to know about that. But here we just try and take care of their health. That's what we
Hmm,
do.
I got you. So they walk in, you greet them at the door. How big's your lobby?
So we share a lobby with a dermatologist here.
Okay.
And so, for right now, that's kind of where our space is at. And it's a great, good sized lobby. But then we're off on the side. We got a couple rooms and we take care of patients over there. And so pretty much getting you right in the room right off the bat.
So you have the patients that are, we're not going to talk about the person you're been. So don't get the wrong idea. But I'm thinking about if the dermatologist is practicing in traditional care, then I'm guessing they've got people in the waiting room, and your people are just walking right in, coming straight in. There's probably a little bit of envy there. I mean, if we're going to be honest.
Yeah. And so absolutely. I mean, our patients aren't waiting, right? They're coming right
Yeah.
in and they don't have a wait. We just don't believe in that kind of medicine.
So they walk in, you greet them at the door, you take them back. You've got how many little exam rooms
And we
or
have two.
triage setup, or what do you have?
Yeah, we have 2 rooms. So we usually do vitals and kind of check them in one of those rooms. I've got a staff member that helps me out with getting that done. We're a very small clinic, and the way that we're able to help pass on savings is by keeping things small and keeping it that way.
Gotcha. So you got them. You have somebody that's helping get them uh, checked in. Now, when they walk in, are you handing them a big stack of paperwork to fill out? How do you even know who they are?
So I know all my patients just by seeing them come in the door. That's something that I didn't know beforehand, right? Before I would have to ask everyone what their name was, but at this stage, I know every one of my patients by name. So they're walking in and I see you and I know who you are. So we're taking care of you right away.
Awesome. I want to take a quick break to talk about bestdpc.com. Are you a doctor looking to break free from the headaches of insurance and take control of your practice? Or maybe you're an employer searching for an affordable healthcare solution that actually works. At bestdpc.com, we cut through the noise and connect you with the country's best direct primary care clinics. Whether you're a patient tired of surprise medical bills or a physician ready to build a thriving membership based practice, we've got the tools and resources you need. Find the best DPC doctors near you, get expert advice, and take the first step towards a better healthcare. Visit bestdpc.com today and see why direct primary care is the future of medicine. That's bestdpc.com, because great healthcare should be simple, affordable, and built around you. So what kind of tool stack, thinking about your tech stack, thinking about the tools that you're using, you've got people coming in, they've got that elevated customer experience. They get to see their doctor right away. They know you, you know them. You're getting them set up. They're not out there waiting. What are you doing as far as tech goes to help through that process? So tell us a little bit about your tech stack. Let's
Yeah,
geek out about tech.
absolutely. So I love my system. My EMR system is amazing because it will send, it has automatic reminders for my patients, so they get their text reminders
Who,
automatically day
tell
before.
me what system are you using?
I use Atlas MD.
Atlas. Yep.
Yeah.
So
So
tell us how
I
it
think
works.
it's a
Sorry.
really good system. It works, integrates automatically with my medical, um, like my note keeping. All of that is together with my texting and my phone calls and billing, right? So it's all kind of a one system that works pretty well for me. And so it automatically sends text reminders to my patients beforehand. And if I want to send them texts, I do that directly from my EMR system so that I'm not having a text conversation with a patient and then having to make notes about what we talk about later. It's just automatically in their system, in their chart, so they can text me personally. We have those conversations regularly, and that's just part of their record, their medical record, because it's a kind of
Okay.
a
So I was
private
going to
reminder.
say, so if they texted you, I'm guessing that the text messaging then is picked up through your system
Yeah,
or
yeah, it's
Atlas.
automatically integrated, so any text they send me just get uploaded into their chart, and it's through the system that we can perform that text messaging.
All right. So what other pieces of tech are you using?
So I use some AI as well. So, AI is here to stay. It's just part of our lives today, and it helps me with writing notes and kind of making my system and my part more efficient, so that I can spend more time with my patients.
Now, is that integrated in your EMR?
It is, yeah. So the AI is there's multiple tools for that AI where I can use it to automatically draft. So I'll review patients' labs, for example, and we're reviewing their labs, and then AI just automatically integrates that into a note that I can then send to the patient so that they can kind of see it really nicely aligned, see all my review on what's going on with their labs, or other things, like we get a bunch of records sent in from another clinic, and AI helps me just analyze that information and pull out those pertinent details, put it into the patient's chart, so that then we can make sure that we're getting them good care.
Well, with a lot of concerns that come out through, privacy concerns, the fact that it's integrated into the system is probably a bit of comfort.
Yeah, I mean, I'm not going to Chat GPT to ask them, hey, here's my patient. What should we do about this? Right? We're
Yeah.
not doing any of that.
Here's my patient. Here's how old they are. Here's where they live. That's how much money they make. You're going to
Right.
keep that private for me, right, AI? You're not going to send a drone after them, are you? So, well, that's interesting because yeah, the different AI models that are out there, I'm curious what they, and I'll do my own research on that. I'm curious what AI model they're tied in with, whether it's one of the open source models like Olama, or hopefully not DeepSeek. I'm just saying, or if it's one of the closed models like OpenAI, ChatGPT, or Claude, or Grok. I mean, there's so many advancements right now with AI. Uh,
Right.
it seems like every day there's some new announcement or some new way to integrate it into your practice. So for you, you feel like the AI has boosted your ability to do what? To provide clearer notes, to shorten your time, administrative headache? Like, what would you
Yeah.
say AI
So
is helping the best for you?
AI is helping to streamline the administrative burden so that I can be more efficient with the things that I'm most effective at, which is taking good care of patients, right? Being there for them. Because in your typical insurance based clinic, right, we would have like a 20-minute appointment, but I'd spend at least 25% of that time just doing documentation, charting, trying to do all that stuff. And so AI is helping to streamline that so that the majority of my time with the patient is with the patient.
Yeah. So, what are you doing for virtual care? Do you have any particular system you're using on that?
So my Atlas MD does that as well. So I have it's got telemedicine services just integrated with my EMR system. And so my patients, when they book their appointments, they can book a face-to-face visit, but if they're like, hey, I want this to be a virtual appointment, we just book it as a virtual appointment. And then I send them a link through my EMR and then automatically pulls up and we have a quick chat virtually. It's been great. I've had patients that have given me great comments that it's streamlined, it's fast, it doesn't take them a lot of time to log onto the system or figuring it out. So that's been awesome.
Gotcha. So, what would you say? Now, what about for other tech? Are you a Google person or using Microsoft products? What are you using just to help with your administrative work?
That's a good question. I mean, I like Google, and I think Google helps me out quite a bit just with a lot of their basic Google Docs and things like that, compiling information and getting patient notes and or like not patient notes, but like the patient instruction. If I want to send a patient instructions and things like that, I can have that all in Google Docs because my goal is I don't think we should be sending faxes anymore. I don't think we should be doing paper anymore. I don't hand my patients paper. They don't hand me paper. Like we just make things electronic. That's the way that our current world should be.
Yeah. So, how then will anyone be able to judge your penmanship for prescription writing if you're doing everything? I mean, you are a doctor after all. I mean, there is a standard of scribbleness that we all expect.
That is true. Unfortunately, then most people just they don't know, and they'll probably never get to see that anymore. So that will be, you know, my penmanship will just stay horrendous, but nobody will ever realize how horrendous it really is, and
I think
that's
we
a
should
shame.
we should probably go ahead and add that into the show notes. I'll send you a notepad, let you scribble, and then take a picture and send it over. All
I'll just
right,
use
so
AI.
you
Have
use
them
the
write it
AI.
for
Recreate it. Okay, so we talked a little bit about tech, your tech stack. What about what are you seeing like a typical day at Health Rising? How many patients are you seeing? How big's your panel? What's kind of your goal for your practice when it comes to how many people you want to see? You want to add more providers? What are some of those things a typical day and what are you looking towards?
Yeah, absolutely. So we're a really young practice. We only opened up last year. So we're at 100 patients, and we're looking to grow. I probably will have around 500 patients for each provider, and eventually we'll grow to have multiple providers. I really see a direct primary care model that incorporates all of your basic primary care needs, any of your chronic care needs, really helping patients to optimize their health. So I envision like a system where we involve a lot of like physical therapy and our therapy services, right? Mental health therapy services, all of those things to have them incorporated so that our patients can have access to all of those things. And what that will actually look like, I'm excited to find out. I don't think I have all those answers yet. But those are things, that's kind of the vision that I have for the long term.
Now, what about pricing? Are you in family pricing? You're doing individual pricing? Kind of what's your approach to that?
Yeah, so
And I
we
know
have a couple of
every mark is going to be different. So anyone listening to this know what goes for Humble, Texas, I guarantee is not the same that goes to New York City, New York.
Absolutely. And I've learned really fast that you can't compare, right? I mean, I think I started doing that, especially when you're gaining your empanelment and you're like, wow, this is going slower than I thought. you have to recognize that every location has its different, things are going to progress differently, and you got to just do focus on you and on what your systems are, where you're at. So for us, our pricing is $99 for anyone 20 to 44, and then above 45 and up is 139, and that's the monthly price. We do an enrollment fee to get people onboarded and help with some of those annual labs, but we include those annual labs with your membership.
Okay,
And
so do you
we,
you draw the labs there?
yep, yeah, we
Uh,
do, we try and create a lot of conveniences, right? So we do our labs in house, so that way patients don't have to make multiple stops.
okay, cool. So I want to transition now, if it's okay, to talk a little bit about preventative care because I know that's a real big passion of yours,
Yeah,
with wellness and considering, those that aspect of your practice. You mentioned your personal health journey. How has your personal health journey transformed how you look at medicine and its role, the role of wellness and medicine and healthy living, and how is that integrated into your practice?
I think that that is a huge driver for the way that I practice medicine and a big reason of why I started my practice. I believe in a very different kind of healthcare than the insurance based model. I think insurance based care is, um, it's essentially stuck in, it's got a lot of problems with it, right? And we could try and get into every single one of those problems, and I just think that, direct primary care solves a lot of those issues. Um, it's a model where the way that our insurance based healthcare is going to make money is if we get as many people on as many medications as possible, and having as many procedures as possible, and seeing the doctor as often as possible. And none of those things were what were needed for me to get healthy and get to where I'm at, right? And so the answers, and this is kind of what I talk about with my patients, right? The real answers to health are within us as humans, right? It's in us, and learning how to bring that out of us with the way that we're living our lives and choosing a different pattern of living helps us to live better and feel better, and that's really the key to health. And so I try and help patients with that. It's a lot of like lifestyle medicine, right? Integrative medicine. There's a lot of different terms for different ways to think about it. But I just try and think of it as health, right? What gets someone healthy, what gets someone to feeling really good, feeling well, and living their lives in that way so that they're loving their lives. And it's really the keys to helping someone to, that's what's going to help someone who's struggling with diabetes, someone who's struggling with high blood pressure, right? The answers, we've gone to medication so often because that's how the billing models are set up in the insurance based system. But you can treat those things without medications, right? If we're living differently and we start eating differently and we start sleeping better and we start connecting socially, that can improve our mental health. That can improve our blood pressure. That can improve these things that we focus on, and we try and push, a lot of the things that the insurance based system is pushing.
So you mentioned sleep. You mentioned what we eat. So tell us, in your mind, how important the right diet, the right sleep, or right amount of sleep, like how does all that kind of mix in healthy living? Like what are some ways that you see, um, that we should really focus in those areas, and what kind of success do we see?
So, well, CDC said 60 to 80% of our chronic diseases are caused by lifestyle choices, right? So if we get ourselves to live healthy lifestyles, we can absolutely significantly we can decrease the burden of these chronic diseases that we're struggling with in our country today.
So what does a healthy style look like?
So
Healthy living. Sorry.
yeah, so I think that we often get stuck in that paradigm of like, what is the healthy answer, right? And we try and make things really black and white. I admit there's a lot more gray to it, right? And it's not going to be perfect for every single person, and that's why we need direct primary care, where we're able to, adjust your healthy living for you based on you, and not compare that to your neighbor and say that that's how you need to live, right? That's how you need to eat. And, that's a lot of the weight loss programs and a lot of, the things that we have today are pushing a lot of, this is the answer, right? This, you have to do it this way. And that's really not the answer. The answer is for you to figure out, okay, well, how is this going to work for me, right? How am I going to make this happen for me? And you can go through each one of those, the main components of healthy living. You're looking at getting really good sleep, right? Adequate sleep on a regular basis.
So 4 hours a night, every other night.
There you go. No, so you got to be sleeping. It's going to be somewhere between 7 to 9 hours of sleep generally for most adults, right? And that's gonna vary, right? You're gonna have bad nights. You're gonna have I've got a baby at home, and it doesn't happen like that every night, right? And so you're having to adjust to your current status of where things are at for you, and that's hard for patients to do and hard for patients to understand. But that's what you got to do. You got to recognize that you can't just pinpoint it and say like, oh, you got to get 8 hours of sleep every night. If you're not getting 8 hours of sleep, then that's the end for you. Like you got to be willing to let yourself be human.
Mhm.
That's a huge part of being human, right? And accepting that, all right, I'm a human. We're going to have a I'm going to have a baby at home, and that's going to change my sleep patterns, and that's okay. And I'm going to get through this, and it's going to be a little different season of life for me. And then when we get out of that season, then we start adjusting to try and help it improve. And I look at that's really how we improve our health is we are continually adjusting and changing as we grow and as we adapt, and as the way that our human body breaks down and we move forward in life. It's going to change the amount of sleep that we're going to get and how well we get that sleep and all the other components of healthy living, right? So you're looking at I was going to mention them, right? I think it's important to kind of know, all right, well, what are
Yeah,
the things that we
to be
focus
looking
on?
at.
There's a lot of them, right? The ones that I try and focus on my patients are sleep, getting really good sleep and trying to get adequate sleep for you for that time period of your life as well as we can, right? And then nutrition, right? Eating whole foods, right?
Like
A lot more.
the whole bag of Funyuns.
The whole Yeah, we've got a lot of processed foods in our country, and we're not eating nearly enough fruits and vegetables, right? And so we're trying to supplement our lack of nutrition in our diet, and that's not the way that it needs to be. You focus on your diet to get your diet right, and then the supplements are where that diet is not giving you what you need, right? So having good nutrition is really important. And then stress management, mental health, right? Those are huge components. It's really about the way that our thoughts are. And I probably won't go too deep into that, but that's something I try and help my patients with, right? Recognizing thought patterns and changing those thought patterns to help them as they're moving forward with their mental health. And then social connection is a huge one, right? We want to connect socially with people. We want to be seen, and we want people to see, we want to see other people and
I
connect
mean,
in a deep level.
that's why we have this video going right now. I feel so connected to you right now. Right? Isn't that what happened during COVID? People turned to virtual meetings, and what happened to our mental health?
Yeah, I mean, you can see it, right? You can see the struggle that goes on there, and we realize, oh, that's a pretty critical component of our health. And to connect with people socially, that's we are social creatures as humans, and we need to connect socially on a regular basis. And that is something that I try and help my patients to do, right? Making goals on that, working towards that. It's something that helps improve your health. Absolutely.
So did you go through all seven? I'm not real good at math.
Let's see. I think I hit most of them. So the sleeves. I mean, those are the main components, right?
How about
Um,
this? How about this? At the end of this, I'm gonna have everybody connected to you. So if we watch this podcast and we're like, hey, he missed one, they can reach out to you and schedule a consultation and maybe become members. Maybe
there
we
you
could go
go.
that
So we're
route.
not going to give you all the answers here because you got to come see me.
That's right. And if
Sure.
you're in Cleveland, Ohio, there is a direct flight to Intercontinental Airport in Houston, Texas. So you
Or
could
we do
be.
telemedicine. We do telemedicine.
Oh, okay. Well, there you go. So part of your practice now, I understand you're starting to work with some small employer groups as well, right? So I guess some of your panel or most of your panel is probably private individuals that found you, um, through your marketing efforts or just being known in the community or a referral from a friend. But
Yeah.
now you're starting to see local businesses and do some corporate wellness type work. Tell us a little bit about that and what you're seeing as far as impact.
Yeah, absolutely. So that's one of the great benefits of DPC, right? We can provide really unparalleled access to medical services to businesses. And that's really what businesses, that's the reason that they wanted to provide medical services, right? They want their employees to be healthy, and they want them to not miss work, and they want them to do good work and to enjoy their job and to stay at their job. And that's what DPC provides, right? You're getting really good retention uh, in your employees because you're working with the DPC. You're getting them really good care. They know what their health's at. They can get access to care really fast, so they're not missing time. They're more productive at work. And so for an employer, it just makes a lot of sense to say, hey, let's use a DPC. We can actually cut a lot of costs, give our employees really good access to care. They get better care, it's personalized, and they're giving me better work. And that's, I mean, isn't that what you want as an
Mhm.
employer?
Yeah. Take a quick break to talk about scalebyseo.com. If you run a direct primary care clinic, you already know the power of patient relationships. But here's the thing, patients can't sign up if they can't find you. That's where Scale by SEO comes in. We help DPC clinics get seen where people are searching. So you're not just waiting for word of mouth referrals. With the right SEO strategy, your practice becomes the obvious choice when people are looking for better healthcare options. If you're not showing up where they're searching, you're missing out. Be visible, get found, grow your practice. Don't leave growth to chance. Visit scalebyseo.com today and let's get your clinic in front of the right people. So, on top of that, like I mentioned, you're working with small businesses. You're starting to see an impact with that. What about just on a very personal level? What are some of the successes you've seen working in direct primary care? I don't think we mentioned this specifically or I asked this specifically, but how much time do you typically spend with a patient, and how has that additional time over traditional medicine maybe enhanced some outcomes for you?
So I have a lot of patients that have had significant improvements in their health with working with me. And I think that is in part because of the time that I'm able to spend with my patients. I'm spending at least an hour with my patients on an initial visit, and then follow up visits, usually like a half an hour. And in the insurance based system, when I was working insurance based care, right, you're probably getting 10 minutes if you're lucky to be with your physician, but it's not the kind of care and it's not the kind of personalization, because in those 10 minutes I'm having to get to know you for the first time. So
Mhm.
now I already know you, and we're spending that time. We already have things that we're working on. We know where your health's at, what your health goals are at, and we're able to work a lot better at moving that needle more significantly towards improving your health outcomes. And so I think it's having really good results in that regard.
Awesome. All right. So, is there a particular success story that comes to mind?
Yeah. So, I mean, I talk with my patients about, I call it like the health rising pathway. To walk through that would probably take an entire podcast, so we won't go there. But it's essentially the process of like making little changes and how you make those small changes on a regular basis to get to where you want to be, to make these big goals, right? Of losing 65 pounds, for example, right? It takes time. So I've had some patients who have worked with me on that pathway and have lost a notable amount of weight, have improved their mental health, and are just feeling a lot better. And I think that it speaks volumes for the kind of medicine that we're trying to practice, where it's not your quick fix type medicine in the insurance based system, that we're seeing that it's just not working like we often want it to.
Mhm. Well, let's transition to another topic. I want to talk about the future of DPC and maybe what you're seeing in your practice, um, in your community, and what are some of the opportunities you see going forward with DPC. Now, obviously, you're in a very large market, and not everybody that's listening to this podcast can relate to being in Houston and competing in a Houston market. But any market, whether there's, a couple million people that live, within 60 miles of you, or a couple thousand people that live within 60 miles of you, there's going to be challenges in growing your practice. So, what are some of the things that you have seen? What are some ways that you found success that could relate to maybe anyone that's listening to growing their practice? Like, what are you seeing as successful things to help grow your practice?
So I mean, it's a lot of like small business work, right? You got to network, you've got to learn how to connect with people, and you've got to do it really quickly and efficiently. And so that's where I'm seeing the most success of just, person to person, one person hearing about me. And there's times when you don't realize what kind of business you're going to get from these small encounters. And so you really have to just put yourself out there. That's one of the challenges of starting a business. That might be an uncomfortable thing to do as a doctor, right? We're not
Mhm.
used to that. It's not something that we've had to do to market ourselves, and that can feel awkward at times. But you have to recognize, like, hey, there's a demand for this. People want this. Whenever people hear about this, they're very intrigued. It's an exciting topic. People want to talk about this, and there's a lot of people that don't know about it. And so I'm doing a lot of educating, a lot of one on one conversations, lunches, just talking to people about what DPC is, how it can benefit them. And, some of the challenges that I see is a lot of people are stuck in the insurance based mindset,
Mhm.
and they are like, well, I have my insurance based care, and that's kind of what we have. But then they have friends who maybe don't have that, or there's certain professions that need DPC, or they're like, hey, I don't have great insurance with my business or with where I'm at. And so we can fill a lot of those gaps for them. So it's a lot of just finding those people, and that's through word of mouth, that's through networking, that's through connecting with people and letting them know that this is an alternative, this is an option, this is available, and then people want to engage with it and connect to it.
So you talked about networking. What type of networking opportunities are you involved in?
Yeah, so I try and leverage my patients, right? So my patients, I have patients who are business owners. I have patients who have colleagues who are business owners, and so it's finding them and saying, "Hey, I'd love the chance to just talk with your boss, or I'd love to come and talk with your employees and just tell them what I do, what I'm offering, and how we can, serve them and meet some of these medical needs that they have going on." I am involved with some other networking groups, right? So I've joined the Chamber of Commerce. I've joined BNI, which is a networking group. And in those groups, we're connecting with other business owners, and we're talking to them about what we do and about how DPC can solve a lot of the issues and the challenges that they have of providing great benefits to their employees. And right now, we're seeing insurance prices are continuing to rise pretty significantly. And I think a lot of, and then, with inflation and just how things are at right now, I think a lot of business owners are looking for alternative solutions to meet the medical needs of their employees.
Yeah, so you mentioned BNI. I'm guessing those type of groups, chambers, BNI, that not only is giving you new relationships, but also helping you refine your pitch, right? Because aren't those
Absolutely.
really great opportunities to say, "Hey, what resonates with somebody?" You might say it 10 different ways to 10 different people to find out, "Hey, this is what really resonates."
Yes, yes, absolutely. And what are those things that get them to perk their ears up and say, "Oh, tell me more about that," or "That sounds like something I want to know more about," right? And that's really what you're trying to find out. And I've learned from networking. It's like developing a relationship, right? And someone's not going to marry you on the first date, and so you can't expect them to join your practice the first time they hear about you. You've got to work at it. You've got to connect with them. You've got to reconnect with them and continue to pursue it and recognize when there's a potential for business opportunity, and accept the fact that it doesn't always happen the first time you talk to someone. That's just part of starting a business.
Yeah. So when you look at the landscape of healthcare and you look at what trends you see in just overall healthcare, whether it's being more proactive and patient focused, and some of those, maybe some of those buzzwords. But when we look at that in trends, how do you think DPC will play a role in that compared to the traditional you go to the doctor when you're sick?
I think there is a huge growth opportunity for that wellness aspect. People do not feel good in the insurance based system, and they want to feel good. They want to feel well. They want to get healthier. They don't want to just have the sick care model that we have, and they're looking for alternatives. And I think DPC provide we are perfectly situated to provide that to them.
Describe sick care. How would you define sick care?
Sick care is essentially recognizing that I'm going to go to the doctor at the last possible second. And that's really what insurance based care is, right? It's if you think about insurance, insurance is really just that's like the catastrophes. It's like, hey, when things are going really bad, that's when insurance steps in sometimes, right?
Right.
And so it's not
Hypothetically.
hypothetically. They're supposed to, right?
They're
That's what
supposed
you're
to.
paying them for.
That's what they're contracted to do, but yeah.
Exactly, and whether they do it or not, yeah, okay. So sick care is essentially that. It's that insurance based model of like, hey, if there's an accident in my health, right? Like the car accident. If there's a healthcare accident with my health, that's when I'll get medical care. And that's really what sick care is. It's just waiting until there's an accident, waiting until, oh my goodness, now you have diabetes. Instead of saying, hey, you know what? It looks like we're on the trajectory to develop diabetes. Let's develop a plan to avoid that. That's really the kind of medicine that direct primary care is trying to develop.
So maybe another way I think about this in direct primary care, it's helping steer people to the most affordable option for their healthcare. So the most
Yeah.
affordable option when you are not a full fledged diabetic with the most expensive drugs is to catch it early. And we hear about that, like people are relieved when they say, "Oh, we caught the cancer early and we're able to do something about it." But at the same time, we have how many stories have we heard? How many people have been in our lives that, oh no, I must have just slept on my left arm wrong, and then their heart attack, and then there's all of these complications of life because they never were preemptively looking at ways to help themselves, and they didn't have someone in their corner that was intentional with them and providing the time with them and looking at their overall holistic healthcare needs.
Yeah, absolutely. I mean, my patients will come into me earlier than they would have typically gone to the doctor before. And the reason for that is because I'm not charging them a copay. We're not doing co-insurance. It's they're already paying for the services. And so they're like, "Hey, well if we're paying for the services, if there's something I think I need to be seen for, let's chat about it." And so I'm able to see them sooner, catch things sooner, and it's easier to treat things when you take care of them sooner.
So, what kind of advice would you give to someone that's looking at, maybe they're in the traditional healthcare model, they're looking at becoming a DPZ provider? What are maybe some words of wisdom or words of advice you might give them?
You'll never be ready. So just do it. I mean, I think there's just a lot of burnout in the insurance-based system. And but then whenever you're trying to change or do something new, there's going to be a lot of challenges and struggles and fears and doubts, and that's just part of being human. And so you have to decide what you ultimately want down the road, right? It's just the same as a patient, right? When you got a patient coming in to see you, you're having to decide, okay, do you want to actually like live on this healthier trajectory, potentially avoid heart attacks and avoid some of the potential things that we see down the road with your current trajectory that you're on? And I think we're seeing the trajectory of the insurance based system is not a trajectory that most physicians want to stay in. And so you have to just decide if that's where you want to continue to chug along and stay. And if you do, then good luck. Hope things go well for you. But I think I just see kind of a whole different type of medicine in DPC. And I think a lot of people are hearing about it. It sounds great, but there's so many unknowns, and it's challenging to do that. But I think it's so much more rewarding to do that, right? It's so much more rewarding to take that leap of faith and just say we're going to try something different because we believe in a different kind of model that gives better care to people. This is why I went into medicine, right?
Yeah. So you say, something I was going to ask you is, did you have someone that was really a mentor for you in direct primary care when you got in? Was there someone that you were able to work closely with for a period of time?
There've been a couple physicians that I've talked to, and just chatting with them about, how did you do this and how did you do that, and and one of them, I things weren't working, and it's like, hey, this isn't working, and he gave me some good advice to kind of revamp my marketing and do some different strategies, and part of starting a business, you're just going to make a lot of mistakes, and obviously we all want to avoid making mistakes, right? That's the goal. But you also have to accept that part of the journey is going to require making mistakes in the process. So you just move forward with it and just say, you know what, my ultimate goal of having a better kind of career and a better outcomes for my patients is higher goal than the struggle and the challenges of making mistakes and losing money in some of these marketing strategies, or all the things, the mistakes that you make as an early business owner. It's just part of that process.
So if you're talking to someone that's really considering making this jump, how would you encourage them related to managing a work life balance? How would that enter into the scene?
So I've had better work life balance starting a business, and it's been a major driver in why I'm doing direct primary care, because I think in order to give the best care to my patients, I have to be in the best place myself. And that means that I'm having a better balance with all of the demands that I have on my time and on my life. I'm a dad of five, right? And so I knew that I couldn't continue with the insurance based model and continue to give the kind of care that I wanted to give my patients. And so if you really want a better work life balance, then I think you need to, as a primary care physician, DPC is going to be the future for us.
Awesome. Well, we've got one last section I want to jump into before we wrap up this podcast. A little section I like to call Keeping It Reels. The purpose of this section is a rapid fire. I'm going to ask some quick questions. Give me a short answer. I cannot promise you'll go viral on social media, but I will do my best to put it out there. So I'm going to ask you a couple of questions. Just throw out what you think might be a good answer, and we'll go with it.
All right.
So, are you ready? You ready for this? Keeping it reals. All right.
Absolutely.
Number one, what is the most surprising thing you've learned about running a DPC practice?
Starting business is hard. It's real hard, but it's worth it.
All right. Number two, if you could have a superpower to help you with your practice, what would that superpower be?
I would divide myself into six different people and have them all be working on six different tasks at the same time.
So it's easier to multiply yourself than just hire people. Is that what you're telling me?
Well, when you hire someone, you have to train them on doing it the way that you want it done, right? And getting it, how you want it to be. So
Gotcha. You are a U.S. Air Force veteran. How has your military experience shaped your approach to healthcare?
so I am much more adaptable, I think. I deployed, I'll tell you a quick story. I had 1 hour. I was given 1 hour to deploy. They called me up. I had just worked a 24-hour shift, and then I deployed, and within an hour was gone again. So that was crazy, but that's just the adaptability that you learn in the Air Force.
Last question. What one thing would you tell your younger self about healthcare?
Ooh, I would say that it's going to be a challenge. You're going to learn a lot, and just keep going.
Just keep going. All right. Thank you, Jordan. Appreciate your time today. That's it for today's episode of the Best DPC podcast. A huge thank you to Dr. Jordan Salmon for joining us and sharing his incredible journey. To learn more about his work, make sure you check out his website. All of this will be in the show notes, so you can click on the link yourself, or if you want to type it in later, it's healthrisingdpc.com. To visit his website, you can follow him on Instagram at healthrisingdpc. For more DPC goodness, head over to bestdpc.com, where you're going to find reviews and directories of DPCs all across America. Look for those that are featured. If they're featured, it means, hey, they are wanting your business, and they want to be in a primary care relationship with you. So please check out bestdpc.com. Follow us on social media. Please, it costs you nothing to subscribe to our YouTube channel. Like, comment, share, click the notification bell. That's all. That's all I ask. I don't ask for a single dime from any of you people that are watching, but please help share the message. Do you like audio podcasts only? Is that your preference? Fine. Follow us on any one of your favorite podcast channels. Until next time, remember, your health matters. Demand the best with direct primary care. Bye-bye.
American healthcare stinks. A maze of red tape and greed that's out of sight. It's time for new choices. A revolution in care.